We'll begin this hour with the Nigerian Association of Resident Doctors, who are asking the federal government to expedite action on payment of omitted 2020 Medical Residency Training Fund before the end of March. Well, this was part of resolutions reached at its National Executive Council meeting, which was held right here in Nigeria's capital, Abuja. The doctors are also asking government to conclude payment of the 2022 Training Fund before the end of May. They prevailed on the state governors to urgently pay arrears of salaries and allowances owed them for as much as 23 months. The doctors are concerned about mass exodus in the medical field and want government to take steps to curtail medical brain drain, while they are also pushing for an increase in the budgetary allocation for the health sector from the subsistence 5% in the 2022 budget to a figure close to 15% as recommended by the 2001 Abuja Declaration for Health Financing in Africa. Well, let's now bring in the president of the National Association of Medical Doctors, that's resident doctors, Dr. Godiya Ishaya, who joins me now in the studio. And thank you so much, doctor, for being here. Well, the last time we had you here in the studio, you had, a strike going on. And of course, when you did call off that strike, we had you here on Arise News. But I've seen that you're actually giving a warning to the government, one for March and another one in May, for them to fulfill. Does that mean that some of the criteria you reached with the government in terms of why you called off your strike last year have not been met?
Well, thank you very much for having me this evening. First, to correct, it's not ultimatum that we're issuing on to the government. However, we are predicating our position based on the fact that the fiscal year, as it were, for the 2021 was extended and is going to end in March this 2022. So we believe there's still window, and since in the supplementary budget for the 2021, it was captured clearly that those who were omitted in the 2020 Medical Residency Training Fund due to underfunding, their budgetary provision were met on the supplementary budget, and since the money is there, the process of releasing the money should be expedited so that they will get their money before the fiscal year runs out.
I come back to you with a direct question. I see that you're dilly-dallying with my answer right now. I know that the resident doctors, you were on strike for almost 3 months last year.
Yes.
Have all the conditions agreed with the federal government been reached right now to avoid such industrial actions from happening in 2022? Is my question to you.
Well, the truth is that not all have been met, but significant number of it have actually been met, and the rest, just as I rightly observe, are also things that we can get it. And since we believe that the government is still on the table, negotiating table with our association, we can keep on pushing it. The budgetary provision was already made for the payment, and since we are within the fiscal year, those we are encouraging the government at this time to expedite action to release it, so that we'll be sure that all the agreement that were reached have been fulfilled within the fiscal year that we are still in.
Right. Okay. So it's a good place to actually, officially start this conversation. I see that beyond even, some of your demands for your association, the resident doctors, you have been regarded as the engine room of any medical facility, especially the tertiary medical facilities across Nigeria. But you have experienced a lot of brain drain in recent years, even though the Minister of Labour and Productivity would not admit to it. But the Nigerians who go to the hospital have seen this happen. So this brain drain in 2022, what should the government really be doing right now to avoid it from continuing?
Well, again, the Minister of Labour has admitted at some point where during budget presentation in the National Assembly, he admitted to the fact that there was mass exodus of health workers to other countries, and because of that, there may be need to bond those who the government is training. So that was a clear admittance of the fact that there's brain drain. So, but of course, what remains is for the government now to look at what are those factors that are actually pushing these people to leave the country, and what are those things that those other people are doing that is pulling them to go to those countries. And that's where we are. And most of the factors that we have always been fighting, we have always been advocating, are some of these things that bothered about engagement of doctors who work and will not receive their salaries. Also, we noted that that is actually the reason why we said that there may be need to increase the budgetary provision. Lack of funding for research, for instance. Almost year in, year out, the budgetary allocation does not provide enough funding for research, and as such, almost every professional want to progress in his career. So because of that, in funding for research, those who want to advance go to places that they feel they can have the funding for them to progress. Then there are other factors. For instance, security of life is very, very important at workplace. Most of our colleagues in our workplace are being kidnapped on daily basis or assaulted. So those without being given the necessary protection, those are things that some of our colleagues do consider, coupled with unemployment and other factors that push them. They go to where they feel they can get better standard of living and also education for themselves and also their families. So there are a lot of factors that we can spend the whole time discussing them here.
Absolutely, because I know that here on Horizon News, we've done our own due diligence, and I do know that for every 5 doctors you speak to, 4 of them are planning to write the NCATs to leave Nigeria. That means there is a problem. But at the end of the day, the fact that Nigeria, we hosted that delegation that signed that Abuja declaration to ensure that at least 15% of our national budget is health related. Well, unfortunately, I have been told that we don't have any more time. Dr. Godiya Ishaya, he is the National President of the National Association of Resident Doctors. Thank you so much, and congratulations again.